Welcome to Evergreen Family Medicine. Today we're with Jennifer Estrada. She's the office manager at Women's Health at Evergreen. Hi, Jennifer.
Hi.
So you've been the office manager with Roseburg Women's Health for quite some time, but there are a lot of changes when it comes to women's health in Roseburg. Tell us what's happening.
Yes, very exciting changes. We had a couple of physicians retire, and so, we definitely still want to continue to grow, and we felt like the merger with Evergreen was a way that we could facilitate that. It works both ways. Evergreen is able to refer patients to us and get them the access to women's care. And we are able to get our patients access to primary care and other things. So it's been a real positive implementation.
So where are you located now, and where will you be located?
We are still located in the same place. We still have the same staff. We are still Roseburg Women's Healthcare, just underneath the Evergreen umbrella. We're on Harvard. It's 1813 West Harvard Avenue, Suite 542. We will probably be there for the next 4 to 5 months. That's going to be a big change as well, because we're kind of set to move over to the old DHS building that they're refurbishing. We're very excited about that. Everything, women always like things new. So we get to have that. And it doubles our space. We're a little bit tight now. And we have a lot of things coming. We have new providers coming in to where we're going to need more room. And so that's something we're all looking forward to.
Something about new providers is very important as well, because you can talk about potentially continuity of care with a provider who might be new, maybe younger, maybe a chance for a long-term relationship with one provider, which I think is very important.
Absolutely. As a patient, you can come in at a fairly young age and have someone that you have working with you that you trust, that you have care, and they can help you through all the steps and the processes that you face as a female. From, menses, birth control, to labor and delivery when you have all your babies, then to, unfortunate menopause and premenopause and postmenopause. So there's somebody there to help you through all of those stages.
So Jennifer, can you talk about the passion that your office and your providers have for providing healthcare to women in the community? Because I think it starts with healthcare, but I also feel like it gets into a whole lot more than just that when you have a personal relationship and you get to know people over time.
Absolutely, especially with women. They're the caretakers of the family usually, and they're always kind of the last in line. They take care of everyone else and they forget about themselves. So oftentimes we'll see a patient who's had multiple issues for a very long time, and they wait until their day-to-day is affected before they come to us. And we really want to kind of head that off at the pass and let them know that we are there for the mundane annual, yearly visits to, hey, things are getting a little bit harder for me, this is happening. We're there, and we are passionate about that. We have to take care of the moms and daughters and sisters and everything out there, because they're out taking care of others.
So I'd like to address some of the questions that people might have as this transition takes place over to the new building and with Evergreen. What are some of the things that you want to make sure current patients know and maybe potential patients are aware of?
Yeah, first off, we realize that change is a little unsettling. However, we've worked really hard with the staff at Evergreen and our staff to make everything very seamless and as painless as possible for the patients. I know we've had to remind ourselves that our day is our day, regardless of, what sign is on the door. So our patients are always first, and they'll continue to, stay a priority. With the merger, they then become a patient of Evergreen's, and they're able to use those resources as well. And just, suggest if anyone has any real specific questions or concerns that they call the office and they talk with someone directly, and we can reassure them of those things.
Well, Roseburg Women's Health has had a great reputation in the community for a long time, and I know Evergreen's excited to bring you folks over and have you as part of the team. So we're looking forward to that transition and seeing you in the new building, in the new space. It's all good things for women's healthcare in Roseburg. And as that transition takes place, you can stay updated with updates on Facebook and also on the website at evergreenfamilymedicine.com. And I'm sure in the newsletter as well, which you can access there on the website. You can also follow what's happening with Evergreen on social media with YouTube, Instagram, Facebook, and Twitter.